Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. CMS released updated federal poverty level guidelines shaping Medicaid eligibility for 2026, and changes reflect a 2.6% increase tied to inflation between 2024 and 2025. For most states and Washington, D.C., 2026 federal poverty guidelines are now $15,960 for a one-person household and $21,640 for a two-person household. A higher threshold applies in Alaska and Hawaii due to cost of living differences. CMS also outlined updated income and asset limits for individuals duly eligible for Medicare and Medicaid. For qualified Medicare beneficiaries, monthly income limits now rise to $1,350 for individuals and $1,824 for couples, with modest increases to allowable assets. Higher income thresholds apply for other dual-eligible categories, including specified low-income Medicare beneficiaries, qualifying individuals, and qualified disabled working individuals. These updates are required by law and based on changes in the Consumer Price Index. While asset limits are set separately by statute, CMS emphasized that all updates are designed to reflect rising costs and maintain access to care. And impact extends beyond traditional nursing homes. Nearly 48% of assisted livings are Medicaid-certified as home and community-based service providers, and almost 18% of AL residents rely on Medicaid to help cover daily care. Additional details are available through CMS's official bulletin and Medicaid website. In 2023, Virginia adopted its first minimum staffing requirements for nursing homes, but built in a safeguard. If the federal government imposed a national mandate, Virginia's rule would automatically repeal. That's exactly what happened in 2024 when CMS finalized a nationwide requirement of 3.48 nursing hours per resident per day. But the federal rule didn't last, and Delegate Willett introduced legislation to reinstate staffing minimums, proposing at least 3.25 nursing hours per resident per day, higher than the 3.08 hours approved in 2023. Stating that Virginia lags behind other states and deferring to experts on the final numbers. Virginia may not be alone in this, with advocates predicting CMS is unlikely to pursue future staffing mandates. Attention is turning to state legislatures. According to KFF Health News, efforts are expected to intensify in the 35 states that already have staffing standards, and in those that don't. Providers say staffing isn't the problem, funding is. The VHCA supports staffing expectations tied to reimbursement, noting the original 2023 standard aligned with the state's value-based incentive program. But higher staffing without higher funding, they say, simply won't work. More than 180 nursing homes are currently suing the state over Medicaid rate-setting delays, inflation adjustments face potential cuts, and survey backlogs continue to strain compliance. As lawmakers debate staffing ratios again, one question looms. Can Virginia require more care without paying for it? Providers are pushing back after the New York Times published a sweeping investigation into the LTC sector's advocacy efforts ahead of the repeal of the federal nursing home staffing mandate, spotlighting industry executives' political donations and private meetings with President Trump, suggesting possible influence over the rule's undoing. But even the Times acknowledged it found no direct evidence linking lobbying to the repeal announced on December 2nd, and noted the staffing rule had already been under reconsideration for months. Industry leaders say the report overlooked the most critical factors behind the rule's collapse: 2 federal court defeats, bipartisan opposition in Congress, and a nationwide workforce shortage that predates the mandate. AHCA called the rule flawed federal overreach, stressing staffing challenges can't be solved without funding and workforce development. Providers also emphasized context missing from the story, including the sector's loss of roughly 200,000 workers since COVID, and years of voluntary investments in wages, benefits, and training, noting mandates without reimbursement risk reducing access to care, especially in rural communities. As debate continues, providers and advocacy groups say the focus should now shift away from blame and toward building a sustainable workforce, because without staff, there's no care. Thank you for joining me for News This Week in Nursing Homes. To get more Qsource news and info, visit qsource.org to view podcasts, sign up for the newsletter, and remember, for all of your QI needs, call the Q.